Everyone, it's Linda McKenna from Golden Rule Senior Placement Services coming to you today with Tuesday Talks. Today being April 16th, it's the actual observance day of National Healthcare Decisions Day. And why is that important to have a discussion? It's really being proactive and having this discussion not only with your senior loved ones, but for your future as well. No matter what age you are, you want to plan ahead and be more proactive in your future when you might not be able to make really logical decisions at a later date. Here's a question posed. National Healthcare Decisions Day is observed every year on April 16th. Are you aware that there are times you might need to make some decisions about your healthcare, but be incapacitated to make them? This day is set aside to help you take care of these potential situations ahead of time. It is a day for patients or healthcare receivers to make known to healthcare professionals the kind of adequate care that they wish to receive and have those wishes being granted and respected and met. So what you'll hear in this topic is this is something that you want to be, like I said, proactive. So why do we wait on planning for our future for healthcare? But when it comes time to purchase a house, we do deep research on it. We go to professionals and all to make sure that everything is signed, sealed, and delivered when purchasing the home. There's a title company involved. Sometimes there's lawyers involved. When purchasing cars, same thing. You go through a real deep research as to the planning stage of purchasing a car and based on outcomes and how it's rated. Lastly, even when going into the direction of planning a marriage and having children, you're really planning ahead. So you just don't jump into these decisions without really careful thought. So why wouldn't you worry about your healthcare decisions now until not wait till the day that some decisions might have to be made for you and it might not be to your liking? So whatever religion purposes are, it has to be acknowledged. Whatever's written today has to be acknowledged because you're in that capacity of making those decisions. So why not be proactive, but more importantly, is to not leave your family or friends in disarray, making decisions that they're not wanting to do because it might not be to your desires. So they feel really morally responsible. So talking about those things, National Healthcare Decision Day is very important to look upon, and what really are the frequently asked questions about it. What is an advance directive? Okay, having worked in home health and healthcare and hospice, believe it or not, even when I worked in hospice, a lot of those folks that were under hospice care didn't know what advance directives are. That means, what would you want in your final days? What would you want? What care in the hospital or by your providers do you want given to you or not given to you? Make those decisions early on and not wait till that proposed time. So advanced directives is something that is it's tender, but it's even more tender leaving that to the decisions of your family members. So why not depict it before time? Maybe it is you don't want a feeding tube, or you do not want specific surgeries or anything that's life-sustaining. And if you don't have that input into place, then the natural thing is to go ahead and provide all those life-sustaining measures. So advanced directives, it could be done on your own, but there's nothing better than having legal tender, actually going to an attorney, a family attorney. And as far as the elders are concerned, our senior loved ones, an elder law attorney is best for this. Having this in place is so important. I can't stress it enough. Having myself being one that cares for elderly parents, but more importantly, it puts your mind at ease that you have something done and it's being done by professionals that are helping you. This will be known throughout your family. So when decisions have to be made later on when you might be incapacitated, it's going to be adhered to. What are the basic healthcare services? Basic healthcare services do a range of activities, including the following unusual physician services: laboratory, x-ray, hospitalization, emergency and preventative service, and out-of-area coverage. So healthcare services, people just think, oh, it's just my doctor's care. So that with that advanced directives and that planning healthcare decisions day, even picking your health insurance is important because it might have limitations that you're not realizing. So you want to really look deep into what you are picking or selecting. So that's why I'm saying an elder law attorney is wonderful for our senior loved ones. And healthcare services are beyond just what the doctor provides or the hospital provides. There's home health services, there is hospice services, and there's two different hospice services. There's, of course, palliative care, and there's end of life. So having that knowledge now, it makes it so much simpler than later on when you have to really make a hard decision. What are the four major categories of health care occupations? The healthcare system offers four broad types of services: health promotion, disease prevention, diagnosis and treatment, and rehabilitation. I can agree with that more because everybody thinks going to see the doctor is going to be the end all to everything. That doctor is your pilot, is your gateway to getting the services that you need. Prescribes or recommends specialists in those areas. If you have been diagnosed maybe with diabetes, maybe go into an endocrinologist that just specializes in diabetes. If you have been diagnosed with congestive heart failure, you do want a cardiac doctor to cover your care as well. If you have been diagnosed with any type of cancer, again, you want an oncologist and a hematologist to follow you in great detail. So all of this really does come into play quite a bit, that it's just not your main provider, it's the specialties, it's laboratories when you do get blood tests, it is rehabilitative services, that meaning after maybe hospitalization is going into a skilled nursing facility, these are the thought processes, or going home with home health, or in a combination of both. So it is something that you want to think ahead now, rather than waiting till that day when it's imminent and having to make a crucial decision. 5 facts about healthcare that will interest you. Technology plays a vital role. There's what they call HIT, which is Healthcare Information System. It is a computerized hardware and software that keeps all your history and physical. It keeps your progress notes. So if you're traveling or you live maybe, and sometimes like in Florida, you're a snowbird, your medical records follow you wherever. That is important also when you're incapacitated. So if that medical record is not known to you, that you could physically tell going into an ER, or your loved one going into ER that has dementia doesn't know their history, that is important to know that there is a medical record, electronic record that keeps track of all that as well too. 4 levels, as we were talking about before, is primary care health professionals, of course, is the gateway, is the nucleus, I call it. And they are ones that send out for consultations and going to secondary care, which is more that of specialists. Then there's tertiary care, which is consultative care for inpatient, and then also an extension to outpatient as well. There is care in the hospital. Might be not your primary that's coming in, so you might have a hospitalist. When you leave the actually the hospital or the going into skilled nursing, there is another medical team. And then after that, maybe you go home and maybe you're not using your primary anymore, and now you have a mobile physician. All those records are going to be combined. You want that they all are talking to each other and have a plan for what your future is, and bringing in maybe your loved one as well too, or your power of attorney. Another thing to see an elder law attorney about. A power of attorney is depicted now in case of an emergency that you're not able to be able to make those decisions. Even healthcare surrogate, there is that good elder law attorney could do that as well. So your 90-year-old father now that is well, but now just had a recent fall and fractured his hip, is in the hospital, been under surgery, been under the influences of anesthesia, can't think right to make his decisions. Guess what? That's where you step in as being the power of attorney and healthcare surrogate. So very important to adhere to. Also science plays a huge role in this. There is no perfect science to healthcare. One doctor always told me when I was working in home health, Linda, that's what we call practice medicine. We are practicing medicine. Sometimes we get it right, sometimes we get it wrong, but we're practicing medicine. So there is no perfect answer to a situation. Sometimes you have to try different modalities, you have to try different medications as well. So, science does play a good role into it. Also laboratories, that when you're taking blood tests and seeing what your future, your history of your DNA, how it could play a big part in your healthcare system. Healthcare extends beyond the delivery of services to patients. It is broad. As I said, it really is a broadened spectrum that everybody needs to be on the same page, and also really making sure that they are providing the services that you require and by your decision making. So why is National Healthcare Decision Day important? Number one, it helps us stay proactive. Can't stress that enough. Make an appointment with an elder law attorney. I am not incapacitated. I already have that. My living will, our advance directives done. So does my children as well too, because they don't want to leave any mess behind for others to make decisions. It saves us, number two, it saves us from bad decisions. Making the decisions now when you're able with a lot of research, even like I said, picking your health insurance. It comes with a lot of branches off. So making the right decision now, later on, won't be a bad outcome. Okay. Number three, it helps us get the best treatment. Insurance, again, plays a big part of that. Know what it offers you, but also know what your limitations are. Knowing now who your network of doctors are to get the best of the best for your care, or having a second opinion, is important for your treatment process. May it be cancer, cardiac, even as simple as diabetic. This is important that everybody is there to work for you, and the right decisions of your healthcare and outcomes are going to be pristine for where you want it to be. How to observe National Healthcare Decision Day. Learn about the best practices. I say that all the time, and maybe have that healthcare proxy, have that healthcare surrogate, have that power of attorney. So make sure that you see an elder law attorney for yourself or for your loved one, or that of yourself, that you go to a family law attorney to do that. Make adequate plans for your healthcare decisions. This is something that I find very, very important. When you have advance directives, not only is your family having copies of that, one is in your glove compartment God forbid that you get in a car accident, file it with each of your doctors, that your primary doctor, your specialist, maybe oncologist. Everybody's on the same program of where your wishes are. So the first responders know how to react, but more importantly, whatever is decided because you have made your decision already of what you encountered when you made that decision. The best part is when you make these decisions, educate and encourage others to do the same as I'm doing with you today. Make sure your neighbor who might be an elderly person, reach out to them or their family and say how important it is to make these decisions now rather than when it's imminent, because honestly there's a lot of detail that needs to go into it then, and you're not thinking right at that point also, and you're very emotional, so no time the best. And having these files, like I said, all over, so this way it's readily available for any family member to tap into as needed as well. Well, all I can say, celebrate today for a good reason so you could have a good future, better quality future, and you're still in control of making those decisions. Thank you for tuning into Tuesday Talks. As always, I lead you to my website, which is www.goldenruleseniorplacement.com. And there you will see not only my bio, you will see testimonials, you will also see my demographics, you will see various options of senior living, resources, a lot of these video talks that you could, a library of 6 years full that you can view at your leisure. Next week, we'll be celebrating on the 23rd of Tuesday Talks. We'll be talking about Parkinson's Awareness Month. Another great topic because April is Parkinson's Awareness. Thank you for viewing in to Tuesday Talks. As always, have a blessed week, and I look forward to seeing you next week on Tuesday Talks with Linda of Golden Rule Senior Placement Services. Bye-bye now.